be here, and as there's lots of people not speaking Czech, so my presentation and my speech will be in English. So, just briefly, my conflicts of interest. I'm co-founder of several institutions, counseling to some companies, and also involved in clinical trials with psychedelics, with different compounds and different companies. So, let's move a little bit to the past, 19th century, where psychedelics were the first tool that was on the market, that was tested in treatment of psychiatric patients. And already at these times, in 50s and 60s of the past century, there was lots of evidence showing that psychedelics might be beneficial in a number of clinical diagnoses. I've borrowed a few slides from David Nutt, which is a famous British pharmacologist, and he states that banning psychedelics in 1971 was one of the biggest, worst censorships ever that happened in medicine. This happened despite the fact that there was quite a lot of evidence about the efficacy and safety of psychedelics, including LSD, and the ban blocked research with LSD, but also at the time blocked the research with psilocybin, which at that time haven't been used so profoundly by the counterculture. If we check this slide, this shows past studies, quasi-controlled studies with LSD in addiction. And these studies show that patients that were treated with LSD-assisted psychotherapy, the therapy was more beneficial than the therapy that was on place at that time. And if we take into account that since 1971, there was around 100 million deaths related to alcohol abuse and addiction, if you would take into account that LSD might save at least 10% of lives, and that theoretically the ban of LSD might protect, let's say, 1,000 people that would be killed by LSD, which is not true. In reality, there is no evidence about that. We have a benefit-risk ratio 1,000 versus 1. There's no other medication in psychiatry use that has such a good profile as LSD in this case. So let's move a little bit to Czech. Czech has a long history of psychedelic research. These are one of the pioneer researchers that were doing lots of experiments in patients as well. It would be worth not to mention Dr. Hausner, who did hundreds of therapies with patients in Czech, and also in our institution that before we were transformed into National Institute of Mental Health, we were called Prague Psychiatric Center, and even before it was Richard Psychiatric Institute, and Stan Grof was working there with psychedelics, and he also developed the holotrope breathwork after that. And there's an old picture of Stan Grof giving EEG and the former buildings of Prague Psychiatric Center with a healthy volunteer or patient, probably. So today we are in a period which we can call psychedelic renaissance. This is what happened with research over the time. You can see the peak until 1971, then everything was banned, and then there is a decline in research, and over the last 10, 20 years there's a dramatic increase, both if you search for psychedelic therapies or psychedelics in research. Any of these terms give you a clear idea of the dramatic increase in interest in psychedelics. And just to give you an impression where the most common drugs, psilocybin and LSD, are currently being tested, this is these are diagnoses which are taken out of the clinical trials, Gov registry, where all clinical trials are presented, and you can see there are over 160 trials with psilocybin, some tens of studies with LSD, and this is already like 7 months back in the history. So, and the diagnoses which are being tested. So there's quite a lot of it. The fact that psychedelics are dominating neuroscience and psychiatry is also understood by regulators. And last year there was a meeting in Amsterdam organized by EMA. Lots of scientists, lots of clinicians, regulatories and industry partners were present, and they were discussing how to use psychedelics and whether there is a way how to implement them into the medical care, into the healthcare system. And there were lots of discussions, lots of talks, and these are one of the key methodological challenges that we are facing with psychedelics. Psychedelics are drugs that, because of the nature of their effects, they are psychoactive, and usually people recognize that they are psychoactive. They have an issue with when you want to conduct a placebo-controlled trials, because obviously when someone is hallucinating, he knows he's hallucinating, and then the unblinding is gone. So one of the first things that was taken out, or being as a key message, is how to deal with blinding and then increase or decrease expectations and nocebo effect, not only placebo effect. The other part is related to uncertainties that relate to how many doses, what are the doses needed, low doses or full psychedelic doses, how long the effect lasts, whether the setting, the environment in which it's taken is important. And these questions needs to be addressed, and there are still lots of data missing. And last but not least, we use psychedelics very often in the context of therapy or so-called psychological support. But the regulators, they want to know, is the drug more effective than current treatment? Is it superior or inferior compared to drugs which have been already present on the market? But with psychedelics, this is a different story. We cannot give full dose of psychedelic to someone who is not experienced and who can be unsupervised and let him go through the experience. That would be too risky. So we need someone who explains in detail what's going on, who works with the patient throughout the session, and who offers some integration. And we can call this psychological support, but we can also use psychedelics as an adjunct to psychotherapy. So there's an ongoing therapy, and on top of that, we can use different psychedelic sessions. This is a typical way how psycholytic therapies work, which can accelerate the therapeutic process. And these things are definitely very important to be addressed and should be taken into consideration when psychedelics will be hopefully registered in the future. So where psychedelics are used. One of the diagnoses or problems where psychedelics might be effective is palliative care, and especially in oncological patients. There's quite a lot of evidence. This is one of the most famous studies with psilocybin in cancer patients, showing that psychedelics can improve depressive symptoms, anxiety, increase quality of life, and increase death acceptance in people who are facing this end-of-stage life situations or threat of being dead. The diagnosis where psychedelics, and I can refer to the first slide with LSD, where psychedelics might be effective, is contrary to expectations. Addiction. Psychedelics are listed in scheduled drugs, which have no potential medical use, most of them, and many of them believed to be addictive. But the truth is elsewhere. Psychedelics are, in many cases, not addictive. Only a few could be addictive, like ketamine, maybe. And actually, they have been shown to be effective in treating different substance abuse disorders, and including alcohol use disorders. So this is a very promising first study on a larger scale study, 95 randomized patients with psilocybin and alcoholism, and they show that there is a reduced drinking and heavy drinking days in this population. More recent trials are needed to be done. There's one recent trial that wasn't that satisfactory, that was performed in Zurich, but we'll see what the future will bring in. There are studies with ibogaine, studies with ayahuasca and other compounds as well. The highlight in psychiatry these days, and nearly on all conferences, is the fast-acting antidepressant effects of psychedelics. Most evaluated, most known is psilocybin. What you see on this scale is a change in depressive symptoms following psilocybin on a MADRS scale, which is the most typical scale used to rate depression. And this study was one of the largest commercial trials conducted by Compass Pathways, evaluating 25 milligrams of psilocybin, high dose, compared to medium dose, 10 milligrams, and 1 milligram as a kind of a placebo or a low dose. What is important to know, these are treatment-resistant patients, so they didn't respond to previous treatments, and they were completely withdrawn from medication. And you can see a quick drop down in the depressive symptoms on day 2, just after dosing. And the effect persisted to the primary outcome, which was 3 weeks after dosing. About about 2/3 of patients were in remission. And at the end of the study, 12 weeks after, several patients were still unmedicated in the 25 milligram group, and about 30% were still in remission. A very interesting study came next, comparison of psilocybin, 2 doses to standard antidepressant drug, which is escitalopram. 2 doses of psilocybin when patients were not using any other medication and they were again treatment resistant, induced the same effect after 6 weeks as continuous use of escitalopram. It is important to know that despite there is no difference between these 2 medications, patients in the psilocybin group were in 60% in remission, while those that were in escitalopram group, they had remission only in 30%. Over time, this effect dissipated, but we know now that psilocybin effects may last from up to 1 to 3 or 4 months, most typically. It's not only psilocybin. Several large companies have published phase 2 trials with different compounds. 5-MeO-DMT, very recent top-line results presented by GH Research showed efficacy of 5-MeO-DMT, shortly acting, very strong psychedelic in treatment-resistant depression. And not only the acute phase, which was blinded, but also in the open-label extension, up to 6 months after initiation of the treatment, with several repeated doses, persistent antidepressant effects resulting in remission in these patients. And important to know, these patients do not take any other medication. Similar findings with DMT, but in this case, it was an add-on to standard therapy, and it was also long-lasting remissions. And most recent, Gilgamesh company came out with a study showing effects of a synthetic derivative of psilocin, which had very powerful effects. It was an IV or IM formulation and very shortly acting psychedelic effect by very prolonged duration, up to 29 days after treatment in a very high number of patients. And again, they were in remission, which is something unbelievable when we compare it to standard drugs. LSD is being tested now and is going in phase 3 for generalized anxiety disorder, and also all these studies have been presented in top-line journals and will be presented in the top-line journals if they were not until now. So let's have a look what's going on here in Czech Republic. As noticed, we have quite a long history, and we also do lots of preclinical research, but let's focus only what is clinical. These are currently running clinical trials in Czech Republic. The 2 trials that we are currently running and we feel are very important are 2 trials that are comparing the effects of psilocybin to ketamine, the only available drug which is used to treat treatment-resistant depression. And actually, we are comparing the effects of psilocybin to ketamine in a 3-arm study versus midazolam in treatment-resistant depression and in oncological patients. In the first study, we have already 46 patients dosed, so we're waiting for 14 to finish the study, and we're currently working on interim analysis, so hopefully soon there will be some data out, and we hope to close the study in a year or so. This is a dosing room, just to give you an impression where we work with patients at National Institute of Mental Health. We are part of a big project which focuses on palliative care, and this is the first project on psychedelics supported by the Horizon program. The proposer, or the main investigator is Robert Chavez from Groningen, from UCMG, and this trial focuses on treatment of patients who have different cause of existential distress and depression than cancer. This is mainly multiple sclerosis, which is our center. In Denmark, they focus on amyotrophic lateral sclerosis. In Copenhagen, they do chronic obstructive pulmonary disease. In Lisbon, they focus on atypical Parkinsonism. We also have here in Czech Republic a new study which focuses on a completely different area, patients that suffer ischemic disease. And actually we have a hypothesis that psilocybin assisted therapy might improve the quality of life and the well-being of these patients. And we would like to measure some quantitative approach and look at the changes in the atherosclerotic plates in the coronary arteries. So this is a study that should start also soon. I believe during the summertime we'll start recruiting first patients into this study, which we have in collaboration at Sion and National Hospital in Prague. Psychedelics are being stigmatized by many people, by authorities that do not understand what is it about. And we feel there is an important effort to give into destigmatization of psychedelics. So we ran this incubation phase project where we asked patients and stakeholders from different areas, including regulatory bodies, police officers, to see and share their experiences with the therapy and share what they feel about psychedelics and their use in the medical care. And in general, we can assume that most of the people said that the medical use of psychedelics could be very beneficial, that there should be a way how to overcome the 1971 conventions, at least for some of the drugs, which seems to be very promising, and that it is a very likely good potential new way of treating certain disorders. We've recently obtained a continuation of this project where we focus not only on the destigmatization, but we also would like to evaluate the cost effectivity and cost benefit analysis of the ketamine-assisted therapy, which ketamine is the only drug which is approved in Czech Republic for different treatments, and it can be used to off-label treat depression. So we would like to check how will ketamine-assisted therapy improve the quality of life of patients and how this will be affecting the socio-economical status of these subjects. And I would say something I didn't expect to get, but this happened 2 weeks ago. We were announced that we got a huge networking project, which is called Cost Action, and it's about psychedelics, and I'm in the position of the chair. This project aims to put all researchers across the European Union that are from the preclinical up to clinical research, that are involved in regulatory bodies, in patient organizations, and to facilitate implementation of psychedelics into medical care, to create guidelines, to create changes in laws that would allow future prescription of psychedelics, and also to collect large data sets for big data analysis from the academia with collaboration with industry. The project has 4 work groups which are dedicated to research mainly, one which is focused on political part, and one which is focused on data sharing. As you can see on the right side, there's a list of countries. There's over 20 countries and 40 institutions being part of this project. So there's a big challenge, and I would say this brings the point that Czech Republic is again becoming a center of psychedelic research in Europe. And on my last slides, I would like to share with you a little bit of what psychedelics can do in patients. There is a trip report, just part of it, converted by an avatar of a patient that went through one of these studies. She believes she had psilocybin, but she was blinded, so we don't know what she had. So you can enjoy how the experience with such drugs can look like in words of a patient.
The 3D film was running incredibly fast. Everything was fast. I couldn't stop jumping from perception to perception. The shapes and the whole images were changing. It was as if they were always projected on a black infinite screen, maybe the universe, also maybe a black tunnel into which the subway enters. Everything still beautiful, lovely, safe, the canvases with their flickering light constantly intersecting and changing parallel stripes advancing into the distance into the black hole and disappearing there, with glimpses of the real, of rational insights. Everything was going so tremendously fast that it was just fragments that could not be finished, could not be figured out. As new and new insights flew by, like some Star Wars flashback, but not a pinhead of discomfort, on the contrary, elation and euphoria. Just watching it, totally fascinated, snippets of how mysterious and perfect and mysterious the brain is, and how brilliant psilocybin is at inducing something so incredible. I've never in my life felt such boundless peace leading to a feeling of happiness to my fingertips, such joy, joy with a sense of security, not a whiff of fear, torment anywhere. It's so amazing.
And I will close with, I have 2 patients. I'm running out of time, but at least listen to just the first one that can report how effective was the therapy that they underwent to treat depression. So there's the first patient, she had 3 ketamine sessions, then repeatedly, and then she had one very difficult experience with a very positive outcome. So just enjoy
I
a
tried
few
not
last
to have
seconds.
expectations. Honestly, I felt like it wasn't going to do anything. I thought I would have an experience, and that experience wouldn't have much effect on who I am and how I live my life. But the last one, the third one, stayed with me, and it was unexpected. For a while afterwards, I thought a lot about the feeling I had been able to experience. Playful, open, free, at peace. It's how the experience takes place inside, how the information comes from within, as opposed to when I compare it to traditional psychotherapy. It's very much about contact and relationship between me and myself, and it's work, but it can be navigated. Overall though, it's just completely different in all aspects than regular therapy. It's much more direct, much more powerful. You know, so much more that something just happened.
Okay, so because of time, I need to finish. So thank you for your attention.
Thank you.